Mystic with Mystic Moments. Today we're going to talk to nurses about their patients with diabetes, your patients with diabetes. Do you understand them? Do you know how to talk to them? Do you know what to ask or what to say? And how to make them understand the things you have to say and the help you can give them can improve their life every day. You have the power to make a difference, even in chronic conditions like diabetes, to make a difference in every patient that you come into contact with. Their life could be better because they talk to you. And when we keep that in our mindset, when we treat and take care of patients with diabetes, it makes such a difference. Not only in the reward that you get for your work, because let's face it, nurses have a thankless job, but it gives the patients and the families such a better understanding of something that is so overwhelming like diabetes. So let's get into it. Your patient with diabetes, they come in and they tell you they're feeling bad, they're going to the bathroom all the time, they can't see straight. You check their sugar and it's, 900 and something. Syrup. Their blood is pretty much syrup. They don't understand why they don't feel good. Well, you start talking to them about their medicine, about what they're eating, about what they're putting in their body to handle and to cope with their diabetes. And if they understand that diabetes is chronic and that every time they decide to take their medicine or not to take their medicine, to eat the right things or not eat the right things, then they're making that decision and committing themselves to live with the consequences of either following their plan of care or not. So it's important to make your patients see the direct correlation between the decisions they make and the way they feel. And if you can accomplish that, you can change some lives. So at the bedside, when you're talking to your patient, you've checked their blood sugar or you've checked their Dexcom and gotten their reading on their blood sugar and look at their trends, and you start talking to them, no matter how old they are, about where their sugars have been, where their A1C is at, and what that means for their overall health and how they feel every day. And it's okay to ask them questions that you would assume somebody who's been diagnosed with diabetes already knows. You can say, what time do you take your medicine? What medicine are you taking for your diabetes? If they don't know, they don't have the tools they need to live with the disease. So your patients who do well with diabetes are going to be the ones who are most literate on their medication regimens, their carb counting, how they're tracking and logging their diet. They're going to be the ones who know that when they keep their sugar under control, they feel better, they live better, they're more active, and they're making an investment in their health for the future instead of, just careening downhill with a 900 blood sugar to end up in and out of your healthcare facility all the time because they can't keep their blood sugar controlled. So diabetes is not simple in any capacity, but it is manageable. And if we can get through to our patients that the management is 100% up to them, and you can make them understand how to read labels on the back of the food they put in their mouth, how to understand which foods affect their blood sugar, and that if they're keeping track of their blood sugar and what they put in their mouth, then they have the keys to the kingdom, because they can look and see, okay, I ate Doritos yesterday afternoon, my blood sugar popped up, and I felt terrible. Those Doritos weren't that good. Maybe I shouldn't make that decision in the future. That's just one example of how you can make a difference in their life. Or, I felt great when I ate pineapple last week. It didn't really affect my sugar that much. I was able to take my insulin or my anti-hyperglycemics ahead of time. I enjoyed the food, and it didn't pay much of a price tag for it. And I had a lot of real natural energy to go do and walk or spend time with my family that I wouldn't have had before. And you've given them a gift. So understanding that diabetes is permanent and it's something that they have to think about every time they make a decision about what to put in their body or whether to follow the guidelines set forth by their healthcare providers or not is important. It's important for you as a nurse, it's important for them as a patient, it's important for support systems like families to understand how they can support their loved one in living a better life, because that's what we all want for the people that we love. So, at the end of the day, it's about serving around common sense. And your common sense as a nurse tells you that your job is to be there and facilitate, to take the information patients give you, distribute it across your healthcare team so that everybody is driving towards the same point of helping patients do better on their own with their self-care, their decisions day in and day out. And at the end of the day, we do no harm and take no shit. Have a great day.